my first presentation will focus on choosing wisely and choosing wisely campaigns. Let's see if that works. Okay, so I have 3 objectives for this presentation this morning. I was told I only have about 15 minutes, so I will try to keep to time. And if I'm speaking too long, please just go. Let me know. Gracias. Okay, so first I will introduce choosing wisely campaigns around the world. Then I will provide some information around how these campaigns and these recommendations have been implemented. And I'll focus on some of the work that's been done in Canada. And lastly, I'll give some examples of low-value care priorities, particularly related to outpatient surgery and anesthesia. And so as Dr. Guerrero said in my introduction, I'm not an anesthesiologist. I'm a health services researcher, PhD. So I hope I can provide some, system information based on my research, but the technical clinical details I will leave to my colleagues. So I have a QR code in this presentation. I will get the results. I'll share it after the presentation. But I wanted to first ask if you can go open the QR code and answer the question with just a few short words. What does choosing wisely mean to you? And we'll review at the end of the presentation. Hopefully we've learned something. And if the QR code doesn't work, you can also go to menti.com and then put in this code. So I'll just give one more second for people to take the QR code if they wish. So I wanted to begin with a case. So this is a case to illustrate the concept of choosing wisely and why choosing wisely campaigns are present. So this is a case of a 65-year-old woman who was seen in an orthopedic pre-assessment clinic because she had knee pain. I'm not going to go through all the details on the slide, but she's very well. She only has a past medical history for hypertension. And as you can see, the orthopedic surgeon recommends that she has a total knee arthroscopy for severe osteoarthritis. Now, she goes to the pre-assessment clinic, and even though she has a history of hypertension, she does not smoke, she does not drink, very, very healthy woman. She swims, maybe she swims in the beautiful infinity pool here at the hotel. So very well, but yet the resident orders baseline lab work, so complete blood count, chemistry panel, hemoglobin A1C, an EKG, and a chest X-ray. Now the chest X-ray comes back and there's a small nodule in her lung, which is shown. So her surgery is delayed for her knee. She has to have a CT-guided lung biopsy. So you can see here some of the results of these tests. And there's a delay of 4 months because of the investigation of the nodule, the pathology of testing it. So in Canada, we wait for surgery. This is a Canadian case. So after she has 4 months of investigation, she's cleared. And so she's booked for her knee surgery a couple of months later, and she has the operation without complications. So if it's okay, maybe I'll pause here, put on my headset and ask, you can either answer me in Spanish or in English. What harms did this patient suffer because of the delay in her surgery? Yeah, please go ahead. Anyone can share. It's nice coming down. What harms did this patient go through? Gracias.
Okay. Tal vez el enfoque equívoco que hicieron de la evaluación de ese paciente retardó la oportunidad de tener una cirugía más oportuna y seguramente afectó su calidad de vida durante ese estudio. Además, fue sometida a un procedimiento invasivo que potencialmente riesgoso, que pudo haber tenido una consecuencia negativa y era totalmente innecesario.
Absolutely. Okay, so I won't put anybody else on the spot. Thank you, Dr. Guerrero. So the patient suffered harm. Her surgery was delayed. She had a biopsy, a very invasive procedure. On top of that, she suffered psychological harm. She was told that she might have lung cancer. It's a very serious diagnosis in an otherwise well woman. So what I wanted to highlight is that this case shows us the harms of overuse, unnecessary testing. So there's harms to the individual here, our patient. So she had an incidental finding. She could have had a side effect from the biopsy. She was stressed. She thought, maybe I have cancer. And also she's taking time away from her family, from her other activities to go for testing, follow-up. Not only does this case illustrate the harm to the individual, it illustrates the harm to the system. I come from Canada. We have limited healthcare resources in Canada. It's a publicly funded healthcare system. If somebody's in front of me getting a test, I wait longer. So her unnecessary follow-up delayed care for others. So there's waste in the healthcare system too, because we're wasting limited healthcare resources. I also wanted to highlight, I'm in a room full of clinicians. She's wasting your time. Your days are getting filled. Your clinic is busy because you're following up on an unnecessary test, on a test that shouldn't have been ordered in the first place. We're wasting lab resources. With COVID, we had many shortages of pipes, different kinds of syringes, tubes. That too, all those blood tests take resources. And then what we'll talk about later on, it also harms the planet. So we'll get to that later. So this case is one of the reasons why we have Choosing Wisely campaigns. So Choosing Wisely began in the United States in 2012, in Canada in 2014. It's now in 30 countries around the world. And I wanted to also highlight the website of the Association of Scientific Societies in Colombia, which has started Choosing Wisely here. I don't believe that the Anesthesiology Society yet has published a list, but there are lists in internal medicine and urology. And so the link is there for you to review. And you can see Choosing Wisely is in many continents around the world. India, I don't have the logos here, Japan, Africa, Europe. So very much a global campaign. And Brazil as well, down in the corner. So these campaigns share a set of core principles to reduce overuse and harm to patients by developing evidence-based lists of recommendations. This work is physician-led, focused on patients, not saving dollars for government. It engages many different clinicians. It's based on evidence, and there's a transparent process to developing it. And so this link here is to a toolkit which shares these principles. These principles were also articulated in a publication in BMJ Quality Safety. I just wanted to acknowledge some of the international leaders of Choosing Wisely from this publication. And so I come from Canada. Here, I'll show you where I live here in Canada. Right around here. And on, no, there, that's not where I live here. My province of Ontario. So this is where I'm coming from in Canada. So Choosing Wisely in Canada is a truly national campaign in our country. And I wanted to show this slide, not for you to read any of the words, but to show you this is something. Choosing Wisely is a concept. It is not owned by one organization. It's a mobilization and a real community of practice that now you globally are part of as well in Colombia. But these are all of the Canadian partners. So hundreds of organizations are involved. So this is a list, the Choosing Wisely list of recommendations. I'll just show you an example. So this is the list from the Canadian Canadian Anesthesiologist Society. And I wanted to highlight again the recommendation related to unnecessary preoperative testing. So all the lists are the same. They start with a very simple clinical recommendation. Don't order baseline chest x-ray in an asymptomatic patient, except as part of a surgical or oncological evaluation. And then they say in the details, while a chest x-ray is important for evaluating a patient before certain surgeries, it's not necessarily indicated for a pre-anesthetic, a routine pre-anesthetic assessment. So again, relating back to the case that we reviewed previously. And then they give some exceptions. So Choosing Wisely is a patient-centered campaign. So not only does Choosing Wisely campaigns provide information to clinicians, to doctors, to nurses and other professionals, it also provides information to patients. So these pamphlets are written very plain language, easy to understand for patients. So I wanted to show you here in a pre-operative assessment, a patient may say, oh, when my husband had surgery, he had a chest x-ray. Don't I need one too? And you can pull this up in your office and walk through the patient. You will be safe in surgery and you don't need a chest x-ray. And there are harms actually to doing the chest x-ray that could delay your surgery and could result in harms to you as an individual as well. So it is very hard to make a change as a clinician, and you're working in organizations that often have systems in place, preoperative checklists. And so what Choosing Wisely in Canada has become a world leader in is around developing toolkits to help inform changes to practice. So this is a toolkit led by a group of physicians at a hospital called North York General in Toronto. And it's called Drop the Pre-Op, cute name to remember. And it's around reducing unnecessary preoperative visits and investigations. And so it's a wonderful toolkit. I have the website link at the bottom. You can download the PDF for free. It is not in Spanish. I'm sorry. But this is a really nice pre-op consult guideline. And again, very hard for you to see on the slide, but I'll tell you very briefly about it. So there's two categories in this table. The first is the surgical category, and the next is the patient status. And you crosswalk them to see what is needed for the preoperative test. So for example, for minimally invasive surgery and the patient is well, no pre-op. And then, it goes more detail. So for example, for the knee arthroscopy there it is, minimally to moderately invasive. And you see you can see, just a consult with the nurse in the pre-op if the patient has some mild health issues. But if the patient, of course, our patients are complicated. So there's always, many exceptions based on the patient's health status. So this can be a way to work with a preoperative clinic, not to say there will be no more preoperative testing, that would not be safe, but what categories of patients need the preoperative assessment and when. So a very nice tool. The last thing I wanted to show you in these slides is an example not only of providing tools to implement Choosing Wisely in practice in Canada, but globally. So Choosing Wisely has a partnership with the British Medical Journal, BMJ, and they publish articles in the education section of the BMJ for a global audience, trying to provide information. Again, I have the link at the bottom here around reducing overuse and implementing Choosing Wisely to practice. So this is an article. It was published by a group actually out of Michigan University, and they highlight again, when it's safe to reduce unnecessary preoperative tests. And they give examples of interventions. So they talk about making changes. It can be hard to make changes. And so they give the example of, an ECG before cataract surgery. And what can you do? This is a problem. How can we, using PDSA and quality improvement, how can we plan? We can review data. We can get buy-in from our stakeholders to change this. We can update our preoperative guidelines, educate staff. We can assess it, and then we can continue to get feedback. So that's one example of, preoperative assessment. But the article also talks about individual level interventions, education, coming to a seminar like this, audit and feedback, sharing data, showing where there's outliers, facility level changes, creating, for example, a low risk preoperative clinic with a nurse, removing default order sets, changing local guidelines. And then this is typically not where Choosing Wisely likes to go, but not paying clinicians when they unnecessarily order. So with that, my time is up. Gracias. I will look forward to the subsequent presentation.